Hi, I'm Steve Broussard. Jennifer Gale is on assignment, and we thank you for joining us for our weekend program that deals with issues of interest to you. Major depression is a common and serious medical illness affecting more than 13 million Americans, or approximately 6.6% of the population in a given year. Here to tell us more and joining us in the studio is medical director and psychiatrist for the TMS Center in Victoria, Dr. John Bouras. Thank you very much for joining us. Tell us a little bit about the symptoms of major depression and how it affects the medical aspect of a person.
Well, thank you for having me to your program. Major depression or clinical depression is not a typical sad or the blues that people experience when something sad happens. It's actually more than that. The symptoms actually interfere with their functioning. People who get clinically depressed, they are not able to sleep, or they're sleeping too much. They're not able to eat or eating too much. They have no energy, no drive, no motivation. They cannot enjoy life. Many times you will hear family members don't know what to do. They feel powerless and helpless. I have a lot of couples coming to me, and usually the husband will think that the wife might be lazy, when in reality they're just depressed and they cannot drive themselves out of the house to do any type of activities. Some people might get even suicidal at times, which is a very serious thing. Usually those symptoms need to last for about 2 weeks for somebody to be diagnosed with major depression, and they do need to cause some clinical significant impairment in their life. Either that might be work or at home.
Yeah, and that was leading up to my next question. It's much more than just having a bad day. This is something that
absolutely.
It can impair social and work situations. Is that right?
That's correct. What we do see is that the higher the functioning of the person, the more they're able to cope with it and keep it together long enough to go to work or go to school, but they come home and then they just collapse, they go to sleep. These individuals, when they decompensate, they don't want to feel that they are depressed. They think they can get it together by themselves. They think they can do it. Well, if they could do it, it would not be clinical depression. So it's very difficult to convince those individuals to get help.
Do we know the cause?
We don't really know everything. We do know that it does tend to run in families, so there's a genetic component. But not everybody that has a genetic history of depression will develop it. It is a medical illness. It just happens to be the brain, it's the organ. So if somebody has diabetes, the organ will be the pancreas. So they have chemical imbalance, so they do not produce enough insulin.
Yes.
People with depression, they have a brain illness, we have chemical imbalance, and they don't produce enough of those chemicals. And we know that stressors in life, any changes in life, can be stressful enough to cause somebody who has the predisposition to get depressed, now they actually get depressed.
Well, when they're going through this, do they realize they're going through depression, or is it something that an outside member, a family member, will notice?
Many times they can hide it very well. It's only when it gets more advanced when they really cannot function and somebody else might have to say something. For example, at work, they might say, you know, you seem to not focus as well. Are you okay? What's wrong? Sometimes actually we see people even self-medicating. They try to use alcohol or some substances just so they feel better or they can go to sleep. It can be very, very lonely experience as people sometimes get withdrawn.
Yes.
So it would take a while before somebody can say, yeah, I'm going to go get some help. Usually a family member or a friend will be able to help them with that.
Are we talking about paranoia? We're talking about situations where you're just kind of worried about things? Or what are we actually looking at?
When the depression gets very severe, it can get to the psychotic range. So people can actually start hearing voices or seeing things. We see that a lot with people who also have some losses, like a loved one passed away, so sometimes they can hear the person calling their name. many times they are able to do okay with that.
Yes.
But if they get to the psychotic range, then they really need to be on medications.
Okay. Is there a particular gender that's more prone than another?
Well, it's interesting to say that. In my practice, I see a lot more females, and there's a reason for that. Women are twice as likely to have depression. Another thing is also men might be more reluctant to ask for help, because that could be a sign of weakness. But I think it's actually a sign of strength when you do actually ask for help. In the same way that if you had any other medical problems, you would ask for help.
All right, stay right where we are. We're going to continue this conversation. Up next, we'll tell you about new technology that can help those with severe depression.